If you have any questions, you can ask, please. Janvan Barkel, dear Ashok, Arun, and all friends in NLR India Foundation, congratulations with this virtual event. May your fundraising and good works benefit from it. I hope the Send Artist performance will be recorded. I would love to watch it in a later occasion. For now, all the best and thumbs up. Janvan Barkel. Thanks a lot for your comment. It was very encouraging. Any other question or comment? I think organizers, you can unmute people who want to ask questions. They can raise their hand.
Or they can put their questions in the chat box also. If you...
Yes. I would like to ask if we are arresting the incidence of leprosy in India. I think over to you, Dr. Agarwal.
Yes. Thanks, madam, for asking that question. And it is one of the very important activities and the goal of zero leprosy, that is stopping the transmission. And for this, madam, as I mentioned in my presentation, we helped in bringing the leprosy post-exposure prophylaxis, and we are actively working with different partners and in all the 7 states where we are intensively placed to work with the different health structures to promote the single dose rifampicin. And madam, I mean, this event itself, I mean, it is to create awareness on leprosy, and including to say that there is a medicine available to prevent leprosy, and also to say that there is a definite treatment for leprosy. It gets cured. The only condition is early diagnosis and early treatment.
Dr. Agarwal, my question to you, I read somewhere the laws about leprosy have been as old as British times. So yes, things are changing now with HIV/AIDS, with malaria. तो हम लोग ये कहते थे कि HIV/AIDS gets more attention because it's a rich man's disease basically. तो इसमें अमीरी गरीबी का भी कोई रोल है क्या?
So certainly, I mean, it does play a role. I mean, leprosy, if we see leprosy, most of the leprosy affected are very, very poor people, and they are marginalized. They're not able to raise their voice. But we saw right from the beginning of the epidemic of HIV/AIDS that a lot of voices came in, and they formed a group called PLHIVs, PLHIV positive groups, right? And they kept on demanding from the system that we require this, we require that, we require medicines, right? We require testing, we require livelihood support. So, and the other big difference was HIV/AIDS actually spreads very fast compared to leprosy. We are fortunate that leprosy spreads very, very slowly, right? Yes, I mean, it's a poor man's disease, and with a poor voice, almost no voice. They just keep on looking for help and support by anyone who possibly might cross their way. Government is trying to scale up its program, strengthen its program, and we are working along with the government in taking forward the measures which are required.
लेकिन एक बात मैं आपसे जानना चाहूंगा कि अगर ये इसे poor man's disease, तो हमें कैसे ऑर्गेनाइज करना चाहिए अपने आप को? Suppose I want to work with you, या जैसे हमारे बहुत सारे viewers जो हैं, they are listening to you. How do they join you?
Yes, sir. जो एक चीज जो सब कोई कर सकते हैं, something which can everyone do, is ये जो whatever information we are able to transmit to you, or you can make your effort to get the right information. So one, you get yourself educated about the right information, that how it spreads is nothing to get scared of. There is medicine available for cure. Only thing is it needs to be early detected and treated. There is also medicine available for prevention, which the contacts can be given, right? So there is nothing which should make us scared of the disease. तो ये जो information है, ये information हम अपने आप लें, हमारे परिवार को दें, हमारे friends को दें, and also influence the society so that the stigma and discrimination is reduced. Second thing which we can do is we can join hands with the organizations like NLR India Foundation to reach out to more and more people, such affected people, because we are connected with the affected people and they require a lot of support. The voices which you heard in the videos, different kinds of support: health support, education support, livelihood support, empowerment support, employment support. So different kind of support they require, right? And all of us, like possibly, I mean, as per our time available, we can even think of volunteering. Or if we do not have time, but we have resources, then possibly you could also provide resources to agencies like NLR India Foundation to implement such things, scale up the programs, and try to reach out services to as many people as possible.
Dr. Agarwal, मैं आपसे जानना चाहूंगा कि is there a area wise also, like some states have more, some states have less, and what is the role of government which should be there? What should government do?
Sir, actually government is doing a wonderful job, and they are in constant discussion with different partners. In fact, in India, I can say that every month we have a leprosy partners meeting, and there are dedicated people in these organizations. And there are some states, like for example, Bihar, Jharkhand, Uttar Pradesh. So these states have little higher number of infections compared to others. But so beyond states, we need to look at the districts. Like for example, in COVID, we are looking at districts for addressing, for better implementation of the interventions. So similarly, sir, the government of India, along with its partners, WHO and other partners, we have identified districts which required special attention, and work is being planned and gradually being done towards that.
Dr. Babi, because I belong to a fraternity which is called Corporate Social Responsibility. So I work in CSR and sustainability domain. That's where maximum my knowledge is. As I found the statistics, there's hardly anybody, at least on the web, who contributes to leprosy as such. So what should be role of the corporate?
Sir, actually corporates can play a big role because as we know that funds are required to do anything, right? And of course, there are other competing priorities. For example, COVID is now the topmost priority. But we also need to see that COVID has also affected the leprosy affected. Yeah, the leprosy affected, the lymphatic filariasis affected. I mean, all those marginalized people are much more affected than you and me, right? So they require support, right? So they should come. They should actually, understand this and try to support agencies which are working on leprosy for the marginalized people. Because in any development agenda, unless we reach out to the last person, right, we are not doing the right job, right? So we should come forward and try to engage with agencies like NLR India Foundation. We are fortunate to have some corporates with us, sir, like ONGC, right? ONGC had supported us a project to build user-friendly toilets, I mean, disability-friendly toilets, right? In schools in a district of Bihar. So gradually the corporates are coming along. The Oracle is also comes and spends time with us. Similarly, we are trying to reach out to more and more corporates, but I think the message has not reached in a manner which is strong enough for them to get motivated and make some real investments. So I think, sir, people like you, Upadhyay, who have been so close to companies and so close to CSR, I think you can help us also in doing that advocacy.
Dr. Agarwal, I work with the organization which works for the #1 in care, elderly care. Their 90% money comes from individual donations. And luckily, over last 2-3 years, 10% is coming from corporate donations, or you call CSR, or whatever name you give it. So what is your strategy to attract it as NLR Foundation? How you want to go about it, and what you need to people like me or the other our viewers, what you would like to do us?
Sir, we will like you to spread the word across. If there are, like I can see 111 people attending this meeting now, and as per registration, around 400 people had registered for this meeting. And there is also a live feed on the Facebook. Yeah. So people who are hearing us, seeing us, they should try to reach the word to the corporates on our behalf, and so that when we get in touch with them, or if they want to get in touch with them, they feel free, and we can then further explain to them the work we do, and we can then design a project which suits both the parties, and accordingly then we can try to help more and more people.